Commitment. For those working in the field of healthcare, it's an essential principle, one that not only impacts quality of care, but can make the difference between life and death. Within this commitment, nurses need to know what the professional boundaries are, what constitutes a conflict of interest, and how to work more collaboratively. With hospitals becoming more like marketplaces and ethical issues getting more complex every day, understanding and maintaining one's commitment can be a challenge.
They know they need to spend more time with the patient, they know they need to talk to them more, they know they need to provide support, moral support and emotional support to the patient, but the reality is the time for that is very limited.
Throughout the world, there are specific codes of ethics that function as reminders of a nurse's ethical duties. Common to all of these is an emphasis on the importance of commitment to the patients they serve. In the American Nurses Association, this is found in the second provision of the Code of Ethics, which will be the focus of this program. It states that the nurse's primary commitment is to the patient, whether an individual, family, group, or community. The primacy of the patient's interest is clearly emphasized here.
Well, I understand completely, Mrs. Perkins. You know what I'll do? I'll call Dr. Knowles and I'll ask him about changing the dosage on your medication to what you were taking at home and see if that helps.
I'd appreciate that. I know how busy you all are.
Oh, no worries. It's okay. That's what we're here for.
There's an inherent or potential vulnerability in individuals who need health care, and it's the nurse's responsibility to work for the patient's behalf as a moral agent and advocate. Advocacy refers to the formal or informal activities of a nurse that uphold the rights of the patient to receive safe care. Advocacy also means to empower the patient to act on his or her own behalf. This involves care that meets the unique and comprehensive needs of the individual and his or her family.
His wife has learned all the dressing procedures, but she works full-time. Is there anyone available to help during the day?
His sister has expressed willingness, and she's home during the day. If they're comfortable having her help out, perhaps that could be the solution. I'll see how they feel about that.
And recognizing the patient's place in the family and other networks. A good plan of care must reflect this uniqueness.
You have to individualize your care. You can't go in and treat every patient the same. You just can't, because not every person is the same.